Hey guys, welcome to another video. Today we'll be talking about hyperthyroidism. We'll be also covering the causes of hyperthyroidism, symptoms, diagnosis, and treatment. So let's get started. So, hyperthyroidism is a medical condition that occurs when the thyroid gland produces too much thyroid hormone, which regulates the body's metabolism. The thyroid gland is located at the base of the neck and produces hormones that help regulate various bodily functions, such as heart rate, blood pressure, body temperature, and metabolism. When the thyroid gland produces too much thyroid hormone, it can cause the body's metabolism to speed up, leading to a range of symptoms and health problems. The excess thyroid hormone can cause the body to use energy more quickly than it should, which can lead to weight loss, increased appetite, and heat intolerance. Hyperthyroidism can also cause an increase in heart rate and blood pressure, which can lead to heart palpitations, chest pain, and other heart-related symptoms. In addition, hyperthyroidism can also affect the nervous system, causing anxiety, tremors, and insomnia. Other symptoms of hyperthyroidism can include excessive sweating, fatigue, muscle weakness, and irregular menstrual periods in women. In severe cases, hyperthyroidism can lead to a condition called thyroid storm, which is a life-threatening medical emergency. Overall, hyperthyroidism can significantly impact a person's quality of life and can lead to serious health problems if left untreated. It's important to seek medical attention if you suspect you may have hyperthyroidism. So there are several causes of hyperthyroidism. First we have is Graves' disease. This is the most common cause of hyperthyroidism. It is an autoimmune disorder in which the immune system produces antibodies that stimulate the thyroid gland to produce too much thyroid hormone. Next we have is toxic adenoma. This is a benign tumor that forms on the thyroid gland. It can produce excess thyroid hormone leading to hyperthyroidism. Third is toxic multinodular goiter. This is a condition in which multiple nodules form on the thyroid gland, causing it to produce too much thyroid hormone. Next is thyroiditis. This is inflammation of the thyroid gland that can cause it to release excess thyroid hormone into the bloodstream. Excessive iodine intake. In rare cases, consuming too much iodine, either through supplements or in the diet, can cause hyperthyroidism. Certain medications such as aminodarone, interferon alpha, and lithium can cause hyperthyroidism as a side effect. Pituitary gland disorders. In rare cases, disorders of the pituitary gland can cause hyperthyroidism by stimulating the thyroid gland to produce too much thyroid hormone. It is important to note that the cause of hyperthyroidism can vary from person to person, and in some cases, the cause may not be clear. A healthcare professional can help determine the underlying cause of hyperthyroidism and recommend appropriate treatment. Here are some common symptoms of hyperthyroidism. First is weight loss. People with hyperthyroidism can experience unexplained weight loss despite having an increased appetite. Hyperthyroidism can cause an increased appetite and cravings for carbohydrates. Hyperthyroidism can cause nervousness, anxiety, and irritability. Tremors. People with hyperthyroidism can experience trembling hands or a trembling voice. Heat intolerance. Hyperthyroidism can cause an intolerance to heat, leading to excessive sweating and discomfort in warm weather. Rapid heart rate. Hyperthyroidism can cause a rapid heart rate, heart palpitations, and chest pain. Fatigue. Despite having an increased metabolism, people with hyperthyroidism may feel fatigued and have a decreased ability to concentrate. Muscle weakness. Hyperthyroidism can cause muscle weakness and a general feeling of weakness. Changes in menstrual cycle. Women with hyperthyroidism may experience changes in their menstrual cycle, including lighter periods or missed periods. Changes in bowel habits. Hyperthyroidism can cause diarrhea or more frequent bowel movements. It is important to note that not everyone with hyperthyroidism will experience all of these symptoms, and some people may not experience any symptoms at all. If you suspect you may have hyperthyroidism, it is important to talk to a healthcare professional. So, to diagnose hyperthyroidism, a healthcare professional will typically begin by conducting a physical exam and taking a medical history. They may also perform one or more tests to measure the level of thyroid hormones in the blood and to examine the thyroid gland. Here are some common tests. First is blood tests. Blood tests can measure the level of thyroid hormones in the blood, including thyroxine or T4 and triiodothyronine, also known as T3. Blood tests can also measure the level of thyroid stimulating hormone, which is produced by the pituitary gland and helps regulate the thyroid gland. Radioactive iodine uptake test. This test involves taking a small amount of radioactive iodine orally and then measuring how much is absorbed by the thyroid gland. A high level of iodine intake indicates that the thyroid gland is producing too much thyroid hormone. Third, we have is a thyroid ultrascan. A thyroid scan involves injecting a small amount of radioactive material into the body and then using a special camera to create an image of the thyroid gland. This test can help identify the cause of hyperthyroidism, such as toxic nodule or multinodular goiter. Fourth, we have is ultrasound. An ultrasound uses high frequency sound waves to create an image of the thyroid gland. This test can help identify the size and structure of the thyroid gland and any nodules that may be present. Fine needle aspiration biopsy. If a nodule is identified during an ultrasound or thyroid scan, a healthcare professional may perform a fine needle aspiration biopsy to remove a small sample of tissue for examination under a microscope. Based on the results of these tests, a healthcare professional can determine whether a person has hyperthyroidism and what is causing it. Treatment options can then be recommended based on the underlying cause and severity of the condition. Now, there are several treatment options available for hyperthyroidism, including medication, radioactive iodine therapy, and surgery. The choice of treatment depends on the underlying cause of hyperthyroidism, the severity of the condition, and the patient's overall health. Here's a brief overview of each treatment option. First, we have is medication. Antithyroid drugs such as methimazole and propylthiouracil can be used to slow down the production of thyroid hormones. These drugs can be effective in treating hyperthyroidism, but they may need to be taken for several months or years to maintain normal thyroid hormone levels. One potential side effect of these drugs is liver damage, which can be monitored through blood tests. Next, we have is radioactive iodine therapy. In this treatment, a patient takes a small amount of radioactive iodine orally, which is absorbed by the thyroid gland and gradually destroys thyroid cells. This reduces the amount of thyroid hormone produced by the gland. One advantage of this treatment is that it is a one-time procedure and it is often effective in curing hyperthyroidism. However, it can take several months for thyroid hormones levels to return to normal, and patients may experience temporary hypothyroidism and underactive thyroid as a result. Surgery. In some cases, surgery can be necessary to remove all or part of the thyroid gland. This can be an effective treatment, but it carries risks, such as damage to the vocal cords or the parathyroid glands, which can affect the calcium levels in the blood. Surgery is typically reserved for cases where medication and radioactive iodine therapy are not effective or not appropriate. It is important to note that each treatment option has its own pros and cons, and the choice of treatment depends on several factors. For example, medication and radioactive iodine therapy may not be appropriate for pregnant women or people with certain medical conditions. Surgery, on the other hand, may be recommended for people with large goiters or nodules that are causing compression of nearby structures. Overall, a healthcare professional can help determine the best treatment option for each individual based on their specific case and circumstances.